I chose emergency contraception for my ethical dilemma. Emergency contraception is birth control that is used to prevent pregnancy after sexual intercourse. It can be used if a condom breaks, oral contraceptive medication is missed, rape or sexual assault occurs, or any circumstance of unprotected sexual intercourse. Methods of emergency contraception are the copper-bearing IUD and emergency hormonal contraceptive pills. Emergency contraceptive pills prevent pregnancy by preventing or delaying ovulation and cannot induce an abortion. The copper-bearing IUD prevents fertilization by inhibiting the sperm and the egg. Emergency contraception cannot interrupt an established pregnancy or harm a developing embryo. Many people believe that emergency contraceptives can cause an abortion, leading to our ethical dilemma. Plan B was first on the market. In 1999, the FDA approved Plan B for the market. It was the first prescription-only emergency contraceptive drug in the United States. In 2001, there was public health groups that filed petitions seeking to make Plan B over the counter. In 2006, Plan B could be sold without a prescription to those 18 or older with a government ID. In 2011, the Plan B one step was available over the counter, and in 2013, it was available over the counter to women of any age. The main ethical debate concerns the question of whether the medication works via preventing pregnancy or ending pregnancy. People with a pro-life belief may confuse the mechanism of action of the medication as causing an abortion, when really only it prevents a pregnancy from ever occurring. Catholics have religious views on birth control, which causes an ethical dilemma in the circumstances of use. Certain states such as Arizona, Arkansas, Georgia, Idaho, and South Dakota, pharmacists have the right to refuse without patient protections. The laws in these states give the pharmacists the right to refuse to dispense emergency contraceptive based on their own religious and personal beliefs without having to provide any patient support. This can result in delayed patient access to emergency contraceptive. Each state has its own laws regarding the right to refuse the medication. In this ethical dilemma, we can debate the rights of the individual versus the religious views of Catholics in medicine. If a young Catholic woman was a victim of a sexual assault and taken to a nearby hospital and requests an emergency contraceptive, say in Idaho, depending upon the pharmacist's discretion, she could be refused the treatment of her choice and must wait until after discharge to take the medication that is bought over the counter. Knowing that emergency contraceptives must be taken between 24 and 96 hours after the event of unprotected sex, a delay in medication administration could result in an unwanted pregnancy. Can you see the ethical dilemma here? Individual emergency rooms in different states across the United States have the ability to make their own policies regarding the information given about emergency contraceptives and dispensing them upon request. An ethical issue is rooted in morals that makes an individual choose between the alternatives that are evaluated as ethical or unethical. It is based upon the perception of the rightness or the wrongness of an act or a situation that affects the society or the individual. The emergency contraceptive dilemma involves pro-life, pro-choice, and the religious aspects. Ultimately, the stakeholder in the dilemma is the woman caught between the potential unplanned pregnancy and the morality of taking a medication that could go against her beliefs. As a childbearing age woman myself, I must include my opinion on this ethical dilemma. I think emergency contraceptives are useful and effective medications. In the instance of sexual assault or rape, the medication helps prevent a pregnancy that could have resulted out of an act of violence. Sometimes women are unable financially to afford a child, or they're just not ready yet, and taking the medication helps prevent them from being in that situation. I recognize the method of action is stopping or preventing ovulation, which in turn preventing pregnancy. To me, that is in no way morally wrong. I can see the opposing side's view and understand where they're coming from, but disagree and think that unwanted pregnancies can lead to neglect, foster cares, humiliation, depression, and ultimately suicide. Another aspect in this ethical dilemma, an emergency contraceptive, is the ability to buy the drug over counter without showing age identification. If a 16-year-old is having unprotected sex and too afraid to tell their parents, she can buy Plan B without their consent. Is that a dilemma, as she's still considered a minor, or is it more beneficial as she can prevent this potential pregnancy on her own without having to admit to her sexual intercourse with her morals are conflicting? When looking at this ethical dilemma, we can review the principles of healthcare ethics. Autonomy is the respect of a person's freedom to choose what's right for them, whether that be taking an emergency contraceptive or not. Non-maleficence is do no harm. That could be taken as do no harm to the unplanned pregnancy by preventing it, or do no harm as to make someone go through with a pregnancy that they're not ready for. Beneficence is all good. All choices are made for a patient with good intent. That could go either way as well. And justice, to treat and provide care fairly to all patients. So we're not going to judge whether this patient decides to use emergency contraceptives or not.